Hello everyone, I hope you all are doing good. This is Anjali from India and I belong to group number 10 and welcome to my third assignment. Now, quickly moving ahead, I would first like to thank you, sir, for taking the time out from your busy schedule. So, I would request you to please introduce yourself to the listeners.
Yep, certainly. But before that, thanks for giving me this opportunity. And I am Dr. Surinkar Mandal, and I'm working in Bihar, India, in a government hospital.
Well, thanks for introducing yourself, sir. Moving on, how are you coping up in this pandemic situation, especially when there is an approaching third wave? And I know that you have recovered recently from COVID, and I myself is recovering from it. And I believe that's quite stressful. So, how would you try to explain yourself, or how would you like to share your experience about it?
Well, as I can already hear from my voice that I still have a bit of cold in me right now, and but I do feel much better. But that is probably because we all have taken, at least I have taken vaccination, and that has definitely helped me speed up my recovery process. Definitely COVID-19 has always known to take a good toll on one's body, and but I think if we do follow the proper medications and the advices of various practitioners that have been told to the patient, the recovery should ideally be not too bad.
Yes,
So
I totally
yeah.
agree with you, sir. And thanks for sharing your experience. Now, coming to the main and the final question of this interview, which is in what way do you experience as a healthcare worker that employment conditions and local economy, as in a positive or a negative way, affect health conditions of your clients or patients?
Okay, so as I already mentioned that I work in a government hospital,
Yeah.
and most of the patients that I actually work with that actually come to my hospital are usually the people who are unable to afford the private treatment, right? So they choose to come to the government hospitals, given that we do not charge anything to those patients because everything is funded by the government itself. But at the same time, even though we are not asking them for, let's say, a doctor's fee, but what would be bare minimum required is that they pay for the material usages. For example, some tests that need to be done, and more than half of the time that I have noticed that the patients simply do not go through the entire recommended tests, do not go through the entire treatment simply because they are simply not able to afford even that. Many of the patients simply are below the, let's say, a poverty line, and they are simply not able to afford that because many of them may just be like like a daily wage workers, right? And they and most of the money that they have are spent on the daily amenities that they need for their home, and they cannot simply go through with spending more than they have. So because of which definitely has impacted many of the patients, and they haven't been able to get the appropriate treatment that they should, especially during this pandemic times that we have going on right now, right? Because of which what has happened is that patients who are not COVID, not COVID positive patients who do not need COVID attention are simply not getting enough attention that they should. For example, if somebody is a diabetic or a hypertension patient, they do not get what they really need from the doctors, and the doctors are simply not available for most part because they have been occupied on other COVID related more serious things, because of which, and even those cases, right, the patients are even not sometimes getting the proper medications because the whole industry or the whole system, the supply chain system itself, is directed towards treating and getting the country out of this pandemic as early and as quickly as possible. Because of which the other patients, as I mentioned, are not getting enough treatment, and we are really risking that side, and this has really affected all the other patients that I have as well.
Okay, so to sum it up, do you somewhere feel that people are still unemployed in our country, and that could be one of the possible reason, for their improper health conditions or your patient. If I say, do you believe on that?
Certainly, if I mean, so many of the reasons that people are not able to afford the treatment or not able to afford the medications or the tests that, as I mentioned, is probably because they are not getting the money that they need. So they are not simply employed itself. So that is definitely one of the primary reasons why my patients or patients of this hospital are not able to go through the required treatment and not able to simply recover, and that is definitely a downfall for them and for all of us.
Okay, so somewhere the economy has been affected because of this pandemic situation even more, and because of the unemployment condition, the health conditions of your patients or your clients are not up to the mark. Is that what you're trying to say?
Certainly, yes.
Oh, well, thank you so much, sir, for sharing your insights and your thoughts on this topic. Well, I'm sure the listeners, listeners would definitely learn something out of it. Thanks a lot.